5 subjects in the experimental group received, actually it says 6 months of training. There were about 18 sessions spread over the 6 months. Data was collected. Training, the control group was promised training at the end of the intervention, so they were sort of a wait list control group, and they were in fact randomly assigned. And data was collected at baseline, 3 months, 6 months, which was the end of training, and then 3 months after the training had terminated. The training goals were to increase support with technology, to present an awareness of safety and security issues related to the internet. It was a concern that the agency had and that a number of the stakeholders had, so we made sure that we built that in right from the beginning. And also to provide information about new tools for connecting with family and friends no matter where they are. And this was sort of the driving message that we were sharing with people to get them involved, that you would learn new tools that you could use to connect with your family. In Michigan, a lot of family leave the state. The economic crisis is increasing the rate of people leaving, but many older adults are left behind, except during the really bad winter when they go to Florida for a couple of months, but otherwise they stay in Michigan. The topics that were covered in the training, there's a long list. We had 18 weeks of training, in a sense, spread over 6 months. Just to highlight a couple that are noted there in yellow. Internet safety and security, voice and video via the internet, getting reliable health information online, family websites and personal blogs. These were examples of the kinds of things that were covered during the 6 months of training. So it really was meant to provide a fairly broad set of beginning skills, and you'll see we had to divide the group into two because some folks started out a little bit more advanced than others. Preliminary results after 3 months, and again, this is an experimental design. So we're talking about compared to their own baseline and compared to the control group. At 3 months, we found that people felt, in the experimental group, felt more comfortable with computers and technology. We had a computer self-efficacy measure. They reported increased use of information and communication technology, so they were using the things that we were teaching them about, such as email, instant messaging, and so forth. And they felt that they had greater social support. We had a fairly extensive social support, social network measure. So after 3 months, compared to both their own baseline and the control group, we're already seeing some positive outcomes in terms of the variables that we were interested in. At the end of 6 months, so this is at the time that the TAP training ended, compared again to both the control group and to their own baseline and to their own score at 3 months. There was higher computer self-efficacy again, so people were feeling, again, more comfortable. More types of ICTs were used, so email, web pages, care pages, Skype, all of these were used more. They were using them to connect with family and friends, okay, which was what our intention had been. There were more people in their social network at 6 months than there had been before. And so if you're thinking about, will teaching people about technology have an impact on their social support network? Our results are suggesting, in fact, that they will. They reported more social support received from family, friends, and significant others. One of the things we did not find, and we'll talk a little bit in a few minutes about why, we did not find significant differences in loneliness or depression scores. So those mental health variables did not change. And instead, we'll talk about at least our best guess as to why that was the case. Between the end of the program and 3 months later, so the program stopped after 6 months, we did another measure 3 months after that. Most of the increases noted above remained, okay, or in fact increased. However, total perceived social support, and especially perceived social support from friends, were lower, about equal to the 3-month level. So what we had was an increase in perceived social support all the way through training, and then when training stopped, it came back down a bit to about the 3-month level. And there were still no differences in loneliness or depression scores. Okay. Lessons learned. And I'm going to talk about 4 different types of lessons learned. That's self-selection, beginners versus intermediate, some issues about things we learned about teaching older adults about computers and technology, and some feasibility and sustainability issues. In terms of self-selection, what we found was that at essentially every stage where people could opt in or opt out of the participating, we had people who were younger, more educated, already were using some more ICTs, were using ICTs more frequently than the people who chose not to. So the participants who actually answered the survey, we almost have to assume were, in fact, somewhat more interested in technology. The people who answered the survey and were asked, do you want to participate in the research? The ones that stayed in the research tended to have all of those characteristics. And the results suggest that there's kind of a ceiling effect going on here. And as we look at the mental health outcome variables, the folks who wound up in the experimental and control group were all too healthy. We really wish that we had people who could have benefited from the intervention. They were too happy, they were too satisfied, their baseline measures were almost too good. From a research point of view, they were too good. I mean, I'm glad for them, they were happy people, but it didn't help the research society. They were too good, so there was a ceiling effect. And I think that points to the challenge in trying to bridge the digital divide, is that the people who are most likely to get into a voluntary program may be the people who need it the least. A couple of quick notes, because I'm running out of time. We did find that there was a difference between true beginners in the group and those who were somewhat more advanced. And so we did have a beginning track and an intermediate track, where the beginning track started with how do you turn on your computer, what is a mouse, right from the essential elementary kinds of things. The intermediate group had already had some email experience, some internet experience. And there were a couple of shifts between the groups in the first couple of weeks, but then things were pretty steady. Teaching older adults, basically, again, I've got copies of the handouts just to read it. What we found was that older adults need extra care and feeding, and the literature is pretty good about that. You can't teach older adults the same way you teach college students. That's really not a surprise. And one of the things we found was that peer-to-peer learning and social time are important. And our assumption about why the scores dropped off after 6 months, between the 6-month point and the 9-month point, was people were not coming together each week for the classes. And part of what we think we picked up at the 6 months was that increase in social support from friends because people were meeting face-to-face. And that suggests that kind of things like computer clubs, some ongoing program to keep people involved meeting each other face-to-face. In terms of feasibility, it was a very expensive model. And so part of what we're talking about is that in a follow-up program, we're starting to use peer tutors as a way to reduce the cost and to make it more sustainable. And for those of you that are still here later on, we've got a project that we've been working on in Hong Kong using peer tutors that we'll be reporting on. And at the end, basically the next step that I think is most important is for us to start thinking about the concept, if older adults in fact become less digitally divided and have more digital skills, how can we begin to develop interventions that take advantage of that capacity and to start using that capacity for older adults and bringing them not only into the current digital era, but using digital kinds of technologies to in fact assist them. Many places have electronic medical records. If older adults can't access them, they can't take advantage of that. Maybe with the skills that these kinds of programs can provide, they would be better able to make use of them. So we need to start thinking more creatively about how to do that. On the handout, you've got contact information and the references, and thank you very much.
Also, in terms of time, well, thank you. Whilst our next presenter gets prepared, so would you prepare to say one question?
Sure. Is there a question? Yes.
Paul, how did you measure the computer proficiency?
The self-efficacy? It was a self-description. How confident you feel?
Right. Where the items come from? Did you create?
No, there's a computer self-efficacy scale that I think is cited in the reference.
Okay.
If not, I can send that to you.
Thank you very much.
Yep.
Thank you. Our next presenter is Ms. Nadine Hussain, Khaled Hussain.